You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
You're listening to the NASP Podcast. This specialty pharmacy podcast is a collaboration with the National Association of Specialty Pharmacy and the Pharmacy Podcast Network. The mission of the National Association of Specialty Pharmacy is to improve specialty pharmacy practice by promoting continuing professional education and certification of specialty pharmacists while advocating for public policies that ensure patient access to specialty medications. As the healthcare industry's leading podcast dedicated to the pharmacy profession, the Pharmacy Podcast Network is proud to bring our listeners the NASP Podcast, in collaboration with the National Association of Specialty Pharmacy.
Hello, my name is Sheila Arquette, and I'm the President and CEO of the National Association of Specialty Pharmacy. I am delighted to welcome my very special guest to this episode of the NASP Podcast. Jessie Heaton, PharmD, MBA, CSP, Vice President of Specialty and Infusion at Maxor, and Michelle Mulgrew, PharmD, Vice President of Commercial Specialty Market Development at Maxor. As the only independent provider of integrated pharmacy solutions, Maxor has spent 99 years delivering seamless, patient-centered care. They blend every aspect of pharmacy strategy to create real, measurable results while optimizing experiences for patients, customers, and members alike. Maxor Specialty Pharmacy is redefining care for patients with rare and orphan diseases. With a long history of comprehensive clinical programs supporting many limited distribution drugs and their URAC specialty pharmacy certification with Rare Disease Pharmacy Center of Excellence designation, Maxor Specialty Pharmacy specializes in providing exceptional holistic care for patients with rare diseases. Their high-touch care with customized care plans designed to meet the needs of the individual patient, along with their rare disease expertise, allows them to advocate for their patients and collaborate with providers, manufacturers, payers, and other stakeholders to create custom treatment plans that result in the best possible care. Jessie Heaton currently serves as the Vice President of Specialty and Infusion at Maxor. With over 20 years of pharmacy expertise and 16 years dedicated to home infusion and specialty pharmacy at Maxor, he has successfully led Maxor's rare and orphan disease programs on a national scale, which includes a heavy focus on cystic fibrosis. His leadership extends to establishing centers of excellence for rare disease programs and home infusion therapies, and showcasing a wealth of knowledge in accreditation, payer, and regulatory requirements for clinical specialty and infusion pharmacy services. Jessie has a Doctor of Pharmacy degree from Texas Tech University Health Sciences Center in Lubbock and an MBA in healthcare from West Texas A&M. Michelle Mulgrew currently serves as the Vice President of Commercial Specialty Market Development at Maxor, where she is responsible for managing the specialty pipeline and securing access to limited distribution drugs for specialty pharmacy patients. She has nearly 20 years of experience in pharmacy services, with over 10 years focused on the specialty pharmacy space across a wide variety of roles, including specialty product management, business development, pharmacy operations, and patient services. Michelle worked in retail pharmacy and then in the pharmaceutical industry prior to beginning her career in specialty pharmacy. She has a Doctor of Pharmacy degree from Rutgers University and a certificate in health economics and outcomes research from the University of Washington. Jessie and Michelle, thanks so much for joining me today. So to start off with, Michelle and Jessie, how do specialty pharmacies collaborate with other healthcare providers to provide comprehensive care for patients with rare diseases?
That's a great question, Sheila, and thanks again for having us here today. In understanding how specialty pharmacies collaborate, I think it's important to recognize just how far pharmacy has evolved in the past 20 years or so. Beyond the advances we've seen in traditional specialty therapeutic areas, there's also been a deeper understanding and advancement within the rare disease space. Ultimately, we know that rare diseases are not that rare. There's over 7,000 rare diseases affecting roughly 30 million Americans, the majority of which do not have a cure yet. This has driven much of the emerging developments in rare therapies, as well as a rapidly evolving care landscape, which has ultimately redefined how we treat and care for our rare disease patients. Part of that is navigating through the complexities that rare disease patients face, and a large component of that is the collaboration and facilitation of care that specialty pharmacies have with other healthcare providers, such as physicians or nurses, as well as having dedicated clinical teams with deep expertise in rare diseases. We work cross-functionally with multiple providers, so the specialty pharmacy can ensure proper care and timely follow-up is completed for our rare disease patients. We call payers, providers, and other entities throughout multiple steps in the process. Sometimes it's necessary to do this with patients or caregivers live on the call to advocate on their behalf and guide them through any questions or barriers. Specialty pharmacies also have dedicated clinical pharmacists. We employ pharmacists that are specially trained in rare diseases who can consult with physicians on care plans that are tailored to patient goals, as well as dosage adjustments or potential side effects. The specialty pharmacy manages complex medication regimens, assists with prior authorizations, actively monitors patient response to treatment, and allows for timely adjustments to care plans when necessary. So essentially, the specialty pharmacy is acting as a central point of contact for all aspects of a patient's rare disease management.
Adding to what Michelle has discussed, there are some additional areas to consider as well. One area of opportunity could be the support for genetic testing. When you consider that rare disease patients already face up to 5 years on average to receive an accurate diagnosis for their condition, a rare disease specialty pharmacy is really well positioned to help navigate through any additional headwinds patients may face while onboarding timely to a new therapy. One example of support could be taking a proactive approach with genetic testing requirements, ensuring that a payer requirements are identified up front and coordinated with the physician could really help minimize unnecessary prior authorization denials and even appeals required in order to obtain approval. Another area we see is support around drug and device coordination. With rare disease as well as many other specialty therapies, drug and device coordination is important and should really be prioritized. A pharmacy's clinical program can often be intensely focused on the drug, but the proper administration of the medication can be just as important. Considering a self-administered injection or self-infused medication, or even one nebulized, ensuring the proper device is selected in order to deliver the proper dosage in the prescribed time is really critical to ensure the patient is able to achieve optimal outcomes. Not all nebulizers deliver the same particle size, for example, or even concentration, volume, or administration time. Some products are FDA approved as a drug-device combination, so they've been studied together and approved together, and some are not and require additional clinical understanding to ensure the proper device selection. This is really an area where I feel rare disease pharmacies are experts in addressing these critical needs holistically and building comprehensive clinical programs to support patients.
And then tagging on to what Jessie just mentioned, if I may add, specialty pharmacies work closely with healthcare providers such as physicians, nurses, and case managers to manage the treatment of patients with rare disease. And this collaboration often involves the coordination of care for patients and caregivers. So facilitating communication between all parties to ensure that treatment plans are followed, medications are dispensed correctly, and patient outcomes are monitored. As a specialty pharmacy, we also provide educational resources to both patients and healthcare providers about the disease and medications, including side effects. So what to look out for, how to mitigate, as well as administration techniques. And of course, we also provide adherence support, things like counseling, customized reminders, such as the right method, right timing of drug administration, and sometimes utilizing technology like apps or devices for medication management. We're here to help patients adhere to complex treatment regimens.
Yeah, it is true that we look to keep patients at the center of all we do. But beyond the ways we support our patients in their journey, we also look to build support to reduce the provider burden. Specialty pharmacies can often take on some of the complex aspects of managing rare disease patients, freeing up healthcare providers to really focus on clinical decision-making. Some areas of opportunity for collaboration could include adherence monitoring. The specialty pharmacies are well-positioned for more frequent engagement with patients, regularly contacting patients to evaluate medication adherence and proactively address any concerns or challenges that they may have about their treatment that could really prevent any potential gaps in therapy and the potential for suboptimal outcomes that lead to unnecessary office visits or hospitalizations. Another area could be prior authorization assistance. I think most everyone listening to this conversation are well aware of the prior authorization hurdles that prescribers and patients face when initiating a new therapy. Navigating this complex process of obtaining a prior authorization approval from the insurance company is an area that I feel a specialty pharmacy can help coordinate and set the patient and prescriber both up for success. From supporting the initiation of the prior authorization, as well as the frequent follow-ups required to secure approval in a timely manner for specialty medications. And then really, lastly, the real-time communication. It's really another important area is consistent and timely communication with both the patient and the prescriber. Ensuring the physician's team is aware of where the patient is at in the journey can help reduce redundancies on both the pharmacy and the physician's side and save valuable time. An example could be utilizing electronic health records and secure online portals in order to share patient information and treatment updates with the physician quickly.
Those are great points, Jessie. I think it's important to also mention the collaboration that occurs between the specialty pharmacy and the manufacturer hub. So one of the key parts of the patient journey where we collaborate is with the manufacturer's hub and the coordination that occurs between us. A lot of manufacturers offer a variety of additional resources or support through their hub partner. And one of the things that we do as a specialty pharmacy is collaborate with that hub well in advance of a manufacturer's drug launch to not only understand what additional support or resources the hub will be offering, but really working together to design a process that ensures the most seamless experience for a patient to be connected to those resources. We want our patients and their caregivers to feel empowered and have all of the tools and support they need to manage their condition.
So how do specialty pharmacies ensure patients have access to the necessary medications for rare diseases, especially considering their high cost and their limited availability?
There's several ways that we help our rare disease patients access their medications. I think the biggest areas by far are navigating through insurance coverage as well as patient assistance. And that being said, the benefits investigation and verification for insurance and drug coverage is a critical step, and it can often be the rate limiting step in the rare disease patient journey. It's important to consider that in addition to drugs that are covered on the pharmacy benefit, there are many drugs in the rare disease space that are covered through the medical benefit. And loosely speaking, about half of the rare disease pipeline are drugs that will potentially sit within medical benefit coverage. So that being said, being highly fluent in navigating the PA process for pharmacy drugs, as well as the authorization process for medical drugs, is critical in ensuring the patient can access their medication as quickly as possible. There's also the possibility of appeals. It's important to understand that denials are not always a hard stop. Having an understanding of the appeals process for that patient's particular plan, such as what additional information needs to be submitted, how it needs to be submitted, whether it's going to be through electronic submission or a peer-to-peer, what time frame are we working with for that appeal submission, as well as how many levels of appeals there are. And often the specialty pharmacy can assist with this appeals process, and the extent of involvement can vary by patient's plan.
So can you explain the process of risk stratification for patients with rare diseases and how it impacts their treatment plans and outcomes?
Certainly. When our team looks at risk stratification for rare disease patients using specialty medications, it largely serves as a predictive analytics tool to identify potential obstacles in a patient's path that could prevent optimal clinical outcomes. These could be associated with decreased physical function, mental health decline, poor adherence to medication regimens, worsening health-related quality of life, more frequent hospitalizations, and potentially increase in healthcare costs. We first look at risk stratification through initial assessment. Through this assessment, we are evaluating patients based on clinical factors like disease state and therapy complexity, comorbidities, patient accessibility, should that be vision or hearing challenges, or caregiver support needs, as well as social determinants of health considerations. Patient engagement is one of the most critical factors in delivering optimum patient care. Understanding any communication preferences or barriers, any required caregiver support needs, or other provider coordination considerations can be vital to ensuring a successful patient journey in our specialty pharmacy. We can use this information gathered to stratify our patients into different risk categories, which can support the most appropriate patient engagement requirements and resource allocation. If you have a patient maintaining optimal compliance with positive patient-reported outcomes, you may not want to burden them with additional patient engagement. However, where a patient with potential predictable risk factors associated with suboptimal compliance, they might need to be placed on a more intensive engagement pathway to set them up with improved opportunity to achieve similar outcomes. Looking a little further at the impact of ongoing treatment, you may see examples such as a high-risk patient. These patients could be patients that might receive more intensive treatments or have a need for more frequent follow-ups. They could have had a recent condition worsening, frequent missed days of school, work, unplanned misses from activities that are scheduled, such as sporting events, or even hospitalizations. A medium-risk patient could be one that doesn't have any observed condition worsening, or maybe is not improving, but has less negative screening metrics identified as a high-risk patient. And then you have a low-risk patient. They might be one more independent with their therapy, while continuing to maintain appropriate compliance with their therapy with little or no negative screening factors. So risk stratification can lead to better resource allocation and the ability to develop more personalized therapy approaches and potentially better clinical outcomes by focusing care where it's most needed. Identifying patient and therapy-specific obstacles early on and then ongoing proactively helps set a patient up for continued success. And just to reiterate, a couple of the data elements, not limited to, but including to our risk stratification, the missed days from work or school, or patient-reported missed planned activities, a child not getting to go to basketball after school or soccer game could be a sign of a risk factor that we're identifying. A mental health screening, physical health screening, any unmanaged disease-related symptoms, adverse drug reaction, hospitalization, ER or clinic visit increases.
That's fascinating. So, I mean, that makes sense, right? The more personalized you can make their treatment plan, the better outcome they're going to have, right? Because you're addressing their individual challenges.
Right. Yeah. I think if you've seen one patient, sometimes you've seen one patient. And so customizing your approach and being flexible is important to delivering, personalized care for each of these rare disease patients.
Yeah. So we've talked about how expensive these therapies can be. So can you elaborate on the types of patient support programs that are available through specialty pharmacies for those who have rare and orphan diseases?
Sure. Rare disease patient therapies can be complex, and patients can benefit from a wide variety of support that may not always be directly associated with the medication, but can be just as important to ensure success with the prescribed therapy. While we strive to do extraordinary things, we pride ourselves on doing the simple things extraordinarily well. Beyond financial assistance that helps ensure patients can access their medications, whether that be manufacturer or foundation assistance, there are also ample resources for both patients and caregivers. We provide upfront a dedicated case manager that is aligned with both the patient and the prescriber. This is to connect them with additional programs that are relevant to their specific disease state and their specific treatment, as well as any outside resources to help mitigate any challenges or barriers that may arise through the assessment process or ongoing on therapy. This really ties back to what we discussed earlier around optimizing the approach with communication for our patients.
Well said, Jessie. I would also like to add that in our engagement with patients, we do have a unique opportunity to bring awareness to the various resources that are available. We can link patients and caregivers to things like educational programs such as workshops, one-on-one sessions, or online modules about living with their condition, as well as psychological support resources like counseling services or support groups to help manage the emotional toll and isolation that rare disease patients can experience. And then going back to the question around the high cost of the medications, I think it's also important to understand what financial resources are available, and specialty pharmacies are well positioned to be able to offer that to our rare disease patients. So many drugs have a copay card that can be applied to patients with commercial insurance that can significantly bring down the out-of-pocket costs for patients that have a high copay, even after approval. And beyond that, there are 501c3 foundations that offer grants to help offset a patient's cost. These programs can vary by amount available and also by diagnosis. And then understanding the timing of when grant funds become available or refreshed or renewed is important for successfully securing copay assistance for a patient. And then if all options are exhausted, many manufacturers have a free drug program that can be utilized as a last resort. The qualifications for these programs can vary based on a variety of factors, so it's important for a patient assistance team to be aware of the requirements.
So, Michelle, as we look into our crystal ball, what future trends do you foresee in the field of rare disease treatment? And how do you think these will impact the role that specialty pharmacies play, like in the next decade or so?
Sure. So I believe that we can expect a significant rise in personalized gene therapies, advanced cell therapies, as well as targeted therapies, leading to a more prominent role for specialty pharmacies in managing complex treatment regimens, providing extensive patient support, and navigating through intricate reimbursement models for these high-cost medications, really with a focus on patient education and adherence to ensure optimal outcomes. So thinking about the gene and cell therapies currently available, but also in the pipeline, I think there's about over 30 cell and gene therapies currently approved in the US, 20 more expected by the end of this year, and I think more than 90 by 2031. As gene therapies become more readily available for a wider range of rare diseases, specialty pharmacies will need to develop expertise in handling these complex medications, including specialized storage, handling, administration protocols, and especially patient monitoring post-treatment. Now, from a clinical perspective, with the rise of personalized medicine within the rare disease space, specialty pharmacies will have a greater opportunity to tailor treatment plans based on individual patient genetic profiles, not only requiring advanced clinical knowledge, but also having that close collaboration with healthcare providers. And then thinking about the administration of these medications, many new rare disease treatments will involve intricate administration schedules and protocols that may require robust patient support services, so beyond patient and caregiver education, but also medication adherence programs, remote monitoring, all things which specialty pharmacies are well positioned to provide. And then to add to that, there's also more opportunity for the advancement of digital health tools for monitoring and patient care. Many digital tools can be customized to a specific therapeutic area or drug, not only making the interactions more relevant and meaningful for a patient, but also allowing for a patient or a caregiver to feel supported in having the tools that they need to manage their condition. And then thinking in parallel to all of these advancements, it's also important to understand the impact of any regulatory changes on the horizon, such as any new regulations or insurance models, which may affect drug pricing, distribution, and patient access.
So Jessie, what advice would you give to other pharmacists and healthcare leaders who are looking to improve their support for patients with rare and orphan diseases?
Yeah, thanks, Sheila. With the growing rare disease pipeline Michelle alluded to, I think understanding the constantly changing environment and manufacturer product support needed requires a constant state of continuous learning. So keeping up with the latest research, pipeline treatments, and patient and product support strategies needed in the rare disease space goes beyond just the clinical support of the drug itself. Build networks. So establishing a strong relationship with industry partners, patient advocacy groups, and other stakeholders in the rare disease community. Patient advocacy groups in the rare disease can be a really undervalued partner in helping all stakeholders involved understand any unmet needs in the service offerings for patients. And leverage technology. Use technology to improve patient adherence, monitoring, and communication, but not allowing it to replace the human touch. Your data can point you in a direction, it could raise a flag of potential concern, but often the value of a live clinical engagement can't be replaced. So use technology where it makes sense to deliver a better patient experience and optimize efficiency within operations, but don't fully replace that patient engagement. Keep a patient-centric approach. So focus on understanding the individual needs of a patient in order to offer holistic support that goes beyond just dispensing the medication. And then lastly, advocate for change. Be active in communities and organizations such as NASP, working towards policy changes that could improve access to treatments or reduce costs for patients with rare disease. So by focusing on these areas, I feel pharmacists and healthcare leaders can significantly enhance the quality of life of those living with these rare diseases.
Awesome. So Jessie, Michelle, if any of our listeners have questions, how do they get in touch with you?
Yeah, and I think our website at Maxor.com and MaxorSpecialty.com both has an overview of our company for Maxor and our services we offer, but then drilling down into our rare disease products and services that we offer. Michelle leads our business development on our rare and orphan side, as well as myself leading operations. So both of us are available. If there's any questions, reach out to us as well.
Awesome. Well, thank you both, Jessie and Michelle, for chatting with me and sharing this valuable information.
Of course, it was our pleasure. Thank you for having us, Sheila.
Thanks for having us today.
As a reminder, NASP corporate members are invited to be my guest on one complimentary podcast per year. For more information about this or other NASP membership benefits and events, please feel free to reach out to membership@naspnet.org or visit our website at www.naspnet.org. Until next time, have a great day.